Hi guys, welcome back to my YouTube channel. Or if you are coming firstly, I am Arushi Bhardwaj, a fourth year medical student, and we'll be talking today about oral submucous fibrosis. This is an ENT topic and it is important because it is prevalent in India. So oral submucous fibrosis is basically a thing which happens due to eating more of like pan, betel leaf and tobacco, and this can further lead to cancers. So therefore this topic is important, and we brush past it the various brief points, and the way I will be telling you, you can write in exams and this will produce you your desired marks because I've only covered the basic headings and the important points. So let us start with definition. What is oral submucous fibrosis? It is a chronic and insidious process which is characterized by juxtaepithelial deposition of fibrous tissue in oral cavity and pharynx. Basically, there will be a lot of fibrosis and lot of collagen present in the mucosa, in the oral cavity. Juxtaepithelial means near to epithelium or next to epithelium. So it is widely common in India due to betel nut chewing. So what is betel nut? It is basically erica nuts, that is the betel leaf which is used in making pan. And in India there is a lot of pan consumption, and so can lead to oral submucous fibrosis. So what are the various causes? It can be multifactorial also. That is the all these factors can also lead to one thing. So there can be only one factor. There can be more than one factor. So poor socioeconomic status. Mainly the people with poor socioeconomic status consume a lot of tobacco. So therefore this can be a factor. Then tobacco, alcohol, erica nuts, that is the pan betel leaf, less vitamin A, zinc and antioxidants, and a hampered immune system. So these are the causes which can lead to oral submucous fibrosis. So what is the pathogenesis? What is happening? Like a person eats erica nuts, so there will be collection of activated T lymphocytes and macrophages in the subepithelial layers of oral mucosa. So there are activated T lymphocytes and macrophages, and also activated T lymphocytes can also convert into macrophages. So what will these cells do? They will reduce the production of anti-fibrotic cytokines. That means there is reduced anti-fibrotics, so there will be more fibrosis, and also there produces less collagenase. So if there will be less collagenase, collagenase is an enzyme which destroys collagen. So if that enzyme is deficient or reduced, it will lead to increased production of collagen, and also it can lead to increased production of fibrogenic cytokines. Fibrogenic means it will produce fibrosis. So these will act on the mesenchymal cells and proliferation of fibroblasts, and therefore further increase in the production of collagen. Macrophages also doing the same thing. So on histopath we can see at early stages the polymorphonuclear lymphocytes and eosinophils, but in the late stage we'll see the lymphocytes and the plasma cells. And also when we see the cellular immunity, we can find T lymphocytes, CD4 cells and macrophages. So this was the pathogenesis, like what is happening when we consume this. So what will be the clinical features? How will the patient present to you? The patient is mainly of the age group 20 to 40 years, and he'll say or she'll say that they are having intolerance to the chilies and spicy food. They cannot eat the spicy food and chilies. They are having soreness of the mouth, and they are having constant burning sensation in their mouth. And if you see the mouth or the mucosa, you can see the vesicular eruption. The vesicles will be present on the palate and the pillars, and the patient will have some difficulty to open the mouth and difficulty to protrude the tongue. So this is how a patient presents to you with a partially open mouth, and he or she cannot open the mouth fully and cannot even protrude their tongue out. So what will the findings? Findings are what you will see in the patient. So changes are seen most marked in the soft palate, the facial pillars and the buccal mucosa. Initially there will be vesicles and redness, but later on there will be fibrosis and scarring and blanching of mucosa. And there will be restricted mobility of the soft palate, the tongue and the jaw. And the patient will also present with trismus. What is trismus? That he or she will not be able to put finger in the mouth or brush his teeth because of trismus, and dental caries and the bad oral hygiene. So this is a picture of oral submucous fibrosis and the bad oral hygiene condition of the patient's mouth. So what will be the treatment? Now you have seen all the findings, you have seen how the clinically the patient presents, you have made a diagnosis of oral submucous fibrosis. How will you treat it? There are two ways of treatment, medical and surgical. For in medical, you will give steroids, topical injection like dexamethasone. You will tell the patient to avoid the irritant factors. You will tell that this was the causative factor and please avoid it. You should not take these. And then treat anemia and vitamin deficiencies and also jaw opening exercises. But if it is a very advanced case, it can lead to cancer stage, then you can remove the fibrotic area and uh, put a flap over there. So there are five options, that is release of fibrosis and skin grafting, but it has a side effect of very high recurrence rate. You can also do a bilateral tongue flap, nasolabial flap, but this will produce facial scarring. Then surgical excision and buccal pad graft and island palatal mucoperiosteal flap. So, if I have to revise what is oral submucous fibrosis, if a short note comes on this, what will you write? That it is a condition, it is a very chronic condition in which there is deposition of fibrous tissue in the oral cavity and the pharynx. It is widely common in India due to betel nut chewing. The causes will be poor socioeconomic status, tobacco, alcohol, areca nuts, and other things. And the pathogenesis is that it will produce activated T lymphocytes and macrophages, which will produce a lot of collagen and fibrotic activity. If clinical features, you have to write that 20 to 40 years of age group is very common, and the patient will present to you with intolerance to chili and spicy food, soreness of mouth, constant burning sensation, vesicular eruptions, difficult to open mouth fully, and difficulty protrude tongue. The findings, the signs which you will be seeing in the patient will be redness in vesicles, fibrosis and scarring, restrictive mobility, trismus, dental caries, and bad oral hygiene. Then treatment, medical and surgical. In medical, you have to give the steroid topical injection and ask the patient to avoid the irritant factors and do the jaw opening exercises. So that was all for oral submucous fibrosis. I hope you liked the video and please give me a like. Thank you.